Hey Warriors, thanks for tuning in. On today's episode of Civic Warriors, we talk about one of the most important topics, preventing pandemics. We're all living through the COVID pandemic, and it's affecting us all in different ways. However, when will the next major virus or other detrimental health impact hit us? 100 years? 20 years? Maybe even next year? We had a great discussion today with Bhavana Chilukuri from Dahlberg Catalyst on what they are doing to raise awareness to preventing pandemics. Dahlberg Catalyst is a 501c3 organization that generates and brings to life multi-stakeholder initiatives to address some of today's most pressing social and environmental challenges. Ultimately, changes need to occur on the local, state, federal, and international level to prevent the next big pandemic. So let's welcome Bhavana to the show and find out how we can prevent the next big pandemic. All right, welcome everybody to our Civic Warriors podcast today. Today we are joined by Bhavana Chilukuri from Dahlberg Catalyst. And we are going to talk about probably one of the most interesting topics that not everybody's talking about, that we want to make sure everybody's aware of and raising the conversation about, and that's preventing pandemics. Many of us are in the time period where we're living through COVID, the COVID-19 pandemic. Different individuals around the world are affected differently. But the bigger issue here is not necessarily COVID-19 as a virus or as a problem. It's more, why did it happen, and how do we prevent a future pandemic or major life-threatening issue from happening based on things that we as human beings are doing either to our earth or to our animals or to whatever it may be that's causing this. So welcome to our show, Bhavana. We appreciate having you here.
Welcome. Yeah, it's great to be here. Thank you both so much.
Yeah, so why don't we just start out, maybe if you can just talk a little bit about yourself, how you got involved with Dahlberg Catalyst, and also how Dahlberg kind of got involved with this concept of preventing pandemics.
Yeah, absolutely. So I'm Director of Programs at Dahlberg Catalyst. I've been working in the social impact space for my whole career, so about 12 years now. And I kind of grew up, my family is of Indian heritage, so we grew up kind of going there every few years, and there's just a lot of, inequality there. And just from a young age, I was like, I think these are the types of problems that, I want to work on. And so I went to school for international development, got my master's, and right away I joined the Dahlberg Group, which is a collection of social enterprises that works on solving the world's most pressing problems. And Catalyst is actually one entity in that group that was started about a couple years ago now, but really relaunched in earnest last year. And we're the only nonprofit in the group. And basically our mandate is to build multi-stakeholder initiatives for impact. So we like to work on what we call systems issues, which are just really thorny issues that don't sit in a specific silo of health or environment or gender, but things that really span multiple sectors and therefore are really, really hard to solve. And so pandemics are a systems problem. They span health, environment, food, climate, all of these different things. And so one of our biggest initiative that we're working right now is how to kind of prevent pandemics at the source. So stopping them before they have a chance to start. And so we've been working on this even before COVID-19 hit. We kind of knew, as we can talk more about, we knew this was coming. This wasn't a surprise, even though it feels like a surprise. And so it's really our job now to make sure that it doesn't happen again, that we don't have another COVID-19 to live through.
Yeah, and it's interesting because I think now a lot of researchers are looking back at, even some simple things as data and what are the signs of COVID-19 before COVID-19. And I think I was having a conversation recently and someone was like, yeah, like you could tell even in like November of 2019, there was this crazy uptick of whether it was flu-related symptoms or people visiting the hospital. There was like a tipping point where they were like, an abnormality, but I think it wasn't chalked up to the global degree that we ended up getting knowledge about in early March. I can't even remember. I remember sitting at home and like, you heard it on the TV, like pandemic, COVID-19, major issue around the world. And you're like, thinking to yourself, when is this going to hit us? How is this going to hit us? And then all of a sudden, like whipsaw, March 18th, the governor is like, hey, you can't go outside anymore. Everyone's like, what?
Yeah, you're like, wait, what?
What?
What do you mean I can't go outside? Yeah, it's scary. It happened what feels like very fast, but the truth is like I think since about the 1940s, there's been about 335 infectious disease outbreaks, and it's been growing. So that's like 50 a decade. And we don't, I mean, here in the US, we don't think about it that much because many of these outbreaks don't reach us. But when they do, it becomes a situation like this. And so, you know, everyone's heard of SARS and Zika, HIV, like all of these things are what we call zoonotic diseases. So they come from an animal pathogen that's passed over into humans. And these things can really surprise us because we have no way of knowing how it will affect humans, like how sick it's going to make us and in what ways. And so COVID-19, even though we knew there was potential for something like this, you know, it's hard to predict that it would get this big. But you know, what we're seeing is that we're more likely to have another global pandemic in the next decade than in the next century because of what we're doing with nature, basically, that we're interacting with nature in this unsustainable way that makes us more susceptible to these diseases. And so that's the thing that we're trying to work on here.
Yeah, and I think it's awesome because you're one of the first, you know, you and the coalition you're working with is the first really to be talking about this. I think it's great you're talking about it during a current pandemic because I think people need to be thinking about the why it happened as opposed to the, you know, why can't I go to 7-Eleven today or whatever, you know, or why can't I go to Starbucks without a mask on? You know, that's probably the most common problem people have, I know, in the United States. But thinking about it, from your perspective, and I think you've talked about this briefly, what are some of the main causes of some of these major, as you mentioned, virus outbreaks, or I don't know if I'm referring to that scientifically correctly, but some of these major outbreaks that have occurred, such as Ebola, such as SARS, such as now COVID? You know, what are the top causes that the science would say create those circumstances from happening?
Yeah, that's a great question, and that's exactly what we're working on here. Our coalition basically puts forward there's a couple different ways in which we are starting to interact with wildlife more and more in a way that is not healthy for us. And so the biggest of these is deforestation. And when we cut down forests, like forests are really, really important in our ecosystem because they house all of this wildlife that basically hosts all of these pathogens. And maybe in the wildlife, they're not causing disease, but they do cause disease for us. So when we're cutting down forests, we're getting closer and closer to wild animals that have diseases that can hurt us. And, you know, at the forest edge, when you have communities living there, that's where outbreaks are going to happen as these communities get closer and closer to the forest. And part of the reason we're deforesting is just like, you know, we're 7+ billion people. There's a lot of overconsumption involved with that. There's so many goods that we consume here in the US, from like potato chips to lipstick, that have deforestation in the supply chain. And so because of palm oil, soy, all of these things, they're included in all of these goods. And if we're cutting down forests to, you know, consume our everyday stuff in an unsustainable way, we're going to have another pandemic. Another reason for deforestation is agriculture, so clearing to grow more food. But there's better ways of kind of going about meeting our global food demand than just clearing forests. So that's really the biggest driver. And then I'm sure a lot of people have heard the phrase wet markets by now. And so wildlife trade and markets is another big driver behind what we call pathogen spillover. So spillover is the passing of the animal pathogen from animals to humans. And wildlife trade is a huge, there's a lot of potential for it to happen because there's all these animals from all over the world. They're not supposed to be next to each other. They're kind of sitting on cages on top of each other. There's like it's very unsanitary in a lot of cases. There's, feces going from cage to cage, and that's like, it's like a recipe for creating a virus like a COVID-19 when you have all these cages stacked on top of each other. And this is because, there's like an exotic pet trade, there's people that consume wildlife, and really that has to stop, except for a few groups like indigenous groups that really depend on wildlife for protein, and have for centuries, and local communities that live there. There's no reason for people in urban centers that have access to other types of protein to eat really wild animals. And so that's a big source of spillover as well. And then we just need, even here in the US, some of our livestock production is really unsustainable with factory farming. And when you crowd animals together like that, that can be a breeding ground for disease as well. So we have our responsibilities here as well. And so all of these kind of three pathways are ways in which, we can get pathogens into humans. And then from there, it can spread so quickly, as we've seen, and then it just becomes really hard to control. And so that's why we want to prevent spillover in the first place.
That's right. Yeah, and I imagine with a lot of the animals in cages and things like that, and you said there's obviously biological components that are passing based on them being trapped in this place, and then people interact with that. There's this phrase in the firehouse, which is if it's warm, wet, and not yours, don't touch it. Kind of like the original like bloodborne pathogen concept, but it's very true. And so a lot of people can't. You're going to start using that. A lot of people can't can't necessarily resist it because the wind blows and you're interacting with this, or you have kids, a kid walks up and kids don't always have the most discretion towards things. They could touch something on the ground and not realize it. And so the reality is, and everything you're saying is exactly on point, just from a layperson like myself, which is how do we prevent those scenarios from even happening? Because you're not going to prevent, once they are there, once there is an animal in the cage, there are overcrowding in a place or wet markets, these things exist. It's bound to happen. There's no way to prevent it at that point. So it's kind of preventing the how do you create these environments that don't include major deforestation where you're now releasing all this wildlife into the populated communities because you took their home, you literally took their home away. So now they're going to try to find a new home. And so on top of just the humanitarian aspect of not taking away all these animals' homes, there's also the concept that now you're releasing this biological weapon into a community that no one really understands. So very interesting. And it's funny because, not funny, but we don't really hear a lot of people talking about that. You hear a lot of people just being like, oh, you got to sanitize your hands, you got to wear 6 masks on your face, but not a lot of people are really talking about why did it happen? And it seems like, and the thing that frustrates me is it seems like you're almost not allowed to talk about why something happened, because now you get into this finger pointing of like, well, you can't accuse them of doing something that you don't know they didn't do. But it's like, but that's not why I'm asking it. I'm asking it because I don't want it to happen again. I'm not asking it because I blame any government or I do anything. I'm asking it because I want to know there's going to be something worse than COVID. There has to be.
Absolutely. Yeah.
I mean, the amount of biological weapons that I'm sure these governments play with, literally play with on a regular basis, that's got to turn into something negative. And now you take the natural elements and, you can't control the natural elements. So you can control things in labs, but you can't control nature. Especially now when we're putting nature to this like real breaking point. We're pushing nature to that breaking point. That's our fault as human beings.
Yeah.
So,
and
interesting.
And just one thing. Oh, go ahead.
Yeah, I just wanted to ask, and then, or actually you go ahead and then I'll ask my question.
Okay. I was just going to say in response to something you said, Brad, around there's something worse. Like there's definitely something worse. We don't know what it is, but and it's hard to say this because COVID-19 has been so painful, but, the fatality rate is not that high compared to what it is for some other viruses. I think it's only around 1 or 2% and higher, if you're older for certain demographics, if you have a pre-existing condition. But there's other viruses like Nipah virus, which is found in bats, that has a fatality rate of 40 to 75%. So if you combine something that has like the contagion, the transmissibility of COVID, which is really easy to pass, right? It's respiratory, so you can just cough and like get it. If you combine that with a fatality rate of something like Nipah virus, like you have the movie Contagion. I don't know if you have seen Contagion, but like that's what you end up with. And not to, we don't want to scare people, but we also kind of want to scare people. Like we have to do something about this. So it could get worse. And then you're totally right that just nobody is. We're all talking about like, let's sanitize our hands and wear masks. And our goal, either, like as a coalition, is not to point fingers or blame, any country. Like this type of spillover can happen in any tropical country. But we also have to look at what happened and say, what are the changes we need to make everywhere, right? It's not on any one country to make sure this doesn't happen, because everyone's talking about vaccines, everyone's talking about, how we can get out of this, and that's great. We need to deal with this current crisis, but it's not just the general public. Even at the highest levels of government, we don't see any people talking about how to prevent this. And so we're really trying to change that narrative.
Yeah. So I was just going to ask, so what do you think are the biggest barriers currently? Do you think that it is sort of being blamed on the fact that it's just too complicated to look back on? So might as well just dive into all the ways to mitigate, like instead of mitigating, let's just tackle what's going on in front of us? Or is it that people genuinely don't know? Or is there a bigger percentage that maybe would rather not know? What do you think are the biggest barriers in just getting to that point of focusing on the root of it a little bit more, maybe than we are right now?
Yeah, that's a great question. I mean, honestly, I think a big part of it is that, like, we as human beings just suck at prevention. We until something is going on, it's even at the individual level. Like, I feel like, it's not until after you have a heart attack that you're like, oh, I should change my diet. Like, I need to start exercising.
Yeah.
But it takes that big event where it's like, where some damage has already been done for people to make a change, even in their individual lives. Like, it's just, you're just focused on like what's right in front of you. And so people don't think ahead, and governments in particular, like, just they're focused on right now and like getting elected and dealing with the right now. They don't have like any incentive really to plan for 10 years down the line. But that's what we need to do. So I feel like that is a lot of the barrier. I think it's just like not in our nature to we have to fight against like human nature, right, to focus on prevention. And then I think another big reason is there's and this is part of the reason we incubated this at Catalyst, the way all of these sectors work together is just very siloed. So right now it's all about health and public health, which makes sense, but we never see public health working together with conservation. But as we move
that's an interesting concept.
further, like into the future, like we're going to see a lot of problems from things like climate change. There are serious, it's not just about like polar bears, right? Like personally, I don't even care. I shouldn't say this in public, but I don't even care that much about polar bears. Like I care about other human beings. And so I personally, my background was always in public, in global health. Like I cared about nutrition, maternal health, like kids getting enough to eat. I didn't care that much about like environment stuff. It wasn't until I started to learn about just how much the environment affects human health that I started to be like, oh, I should also care about that. But that's not happening, I think, at a large scale, where you can kind of put some public health money towards conservation in recognition of the fact that conservation is public health. It really is at this stage. It's not for the polar bears. It's like for our own health, and our own interests to care about climate change, and particularly for pandemics. Like, so much of the conversation right now, as we've been talking about, is on health systems preparedness. Like, how do we make sure we have enough beds, enough PPE for doctors? Like, we saw this last year in New York, where doctors and nurses like had to reuse masks. They didn't have anything, and that was horrible. And I don't know if you all are following the situation in India right now, but absolutely horrific, like what's happening there with this surge. And I think in Delhi, at some point, the infection rate was 3%. A month later, it was 36%.
Oh my
To
God.
have that kind of surge in a place like India, where it's so crowded, there's literally people, outside of the hospitals, like begging people to take, their mom or their dad inside, and there's just no space. There's no oxygen. All of this stuff. And it's so hard to watch those images. And I'm hearing from my family there, they're like, they can't go outside. They've been inside their house, not even a walk outside for 15 days. People are posting on Facebook and LinkedIn, right, to try to find a hospital bed. Like, it is a dire situation.
Yeah.
And so when we see that, we talk, we're like, we have to have health systems be better prepared, and that's so important. We're not saying take any money away from health system preparedness, from oxygen or anything like that. But it's really hard to prepare for a 3% to 36% surge, because we can't prepare for government saying dumb things, like leaders encouraging people, as it happened in India, to like just go to political rallies, to do all this stuff. It's hard to do health system preparedness, and so we have to supplement that by just stopping it. Like it's so much more effective just to stop it at the source, because once it gets out of control, there's a lot of pain and suffering that comes with that, and you can see that now in India. So that, like, our best bet is to kind of invest at all stages, and that includes the pre-spillover prevention, surveillance, containment, preparedness, all the way to vaccines. We can't just keep it on vaccines.
Yeah, and I'm sure the more research that's done on it, and from my perspective, it seems much more cost effective to just try to mitigate the threat originally, to try and go after how to prevent these outbreaks than to then, after the fact, come up with the vaccines, do all of the additional work that comes with it, all of the pain, all the suffering, people dying. You can't make up for that. The money that would be invested would be so much more worthwhile, it seems. Like time, money, just
Absolutely.
like people all around.
Yeah, and we've looked at some of like the cost of it as well. There was a paper published last year in Science magazine where they estimated, and some of the authors are in our coalition, so we're working with them directly. And I mean, prevention's not cheap if you're talking about global efforts, but it's way cheaper than what we just went through, right? It's about 20 to 30 billion to do things like cut deforestation in half, shut down unnecessarily wildlife trade, invest in the early detection and surveillance, compared to, I think the latest estimate from the World Bank from what we've lost from COVID is about $10 trillion, right? And that's not counting all the people who've died, all of the people who have like the long haul symptoms, that aren't going away after months. Everything that's happening to kids and like the education, particularly for more vulnerable kids, like they've lost a year of school, the social isolation, parents, having to do all like work while taking care of kids. We don't even know the full ramifications of like the social and emotional toll on, us as a society. So that to me is more meaningful than the 10 trillion. So it's really it just makes a lot of like cost sense to just invest in the prevention.
Yeah, no doubt. And I in the article that you sent over to us in Politico, they had that statistic too, where I think it was, and I read it, I just saw billion versus trillion. It's like 20 billion to invest resources to prevent. However, because we didn't put in those resources, it's now add another 3 zeros to that, and now you have $15 trillion of damage to the global economy because of this. And you're right, that's a financial metric. That's not even describing the impact it has on mentality. And I mean, my lifespan has definitely gotten shortened by having 2 full-time working parents and kids. I can tell you that. You know, that
I
it's
don't
like a
know how
cigarette. It's like a
people do that.
cigarette. It definitely took 7 years off my life, like no doubt.
Yeah, yeah. No, it's hard, and we're still in it. Like I think we're still in
Oh yeah.
this, right? It's easy to and in some way, I mean, I'm getting my second shot tomorrow, which I'm excited
Oh,
about, and
cool.
so it feels, at least in the U.S., like I feel like shots are hopefully available for those who want to get it, who are willing to get it, but that's not the case for a lot of other countries. They
Right.
won't get this vaccine till like 2022, and so this
Mm,
we don't know. Like COVID-19 could become like an endemic, likely will become like an endemic thing like the flu. Um, and I've been reading that the vaccine is only effective, proven for 6 months. So it's like, will we have to get boosters every year? Like these are all questions. I
Yep.
don't want to get a COVID-19 shot every year, but obviously I will if that's the situation. But I'd rather not figure out what the next pandemic is and have to add another yearly shot, right? So
yeah,
that's what we're looking at.
yeah. How does from your perspective or conversations you've had, how does the conversation differ from like country to country right now as far as prevention,
Yeah.
where they're at and all?
I think overall what we found is that it does seem to be like missing kind of globally, like, and that makes sense. Like we're in this pandemic right now. It's really hard to expect folks to think about the next one. But the reason we started this effort during COVID-19 is because again, like we're also collectively bad at prevention. I don't know that anyone would be listening if we were trying to talk about this, not during a pandemic. So it hasn't. We're seeing some receptivity. We've had lots of conversations on Capitol Hill with both Republicans and Democrats on this issue, and so we're seeing more knowledge being gained on like, okay, prevention is important. There are a few bills on the floor to do things like control wildlife trade, and so we're hoping to see more of that. Even in China as well, we've seen examples of some progress. So there's a program in China now where they are basically compensating, they're paying wildlife traders to exit that
Wow,
occupation. Yeah, they're
that
just
seems like a
interesting.
huge deal.
yeah, and I think it's a great solution because there's always people involved, right? Like anytime you ask them to, you can't just ban wildlife trade and expect it to be okay, because those are people with families, they have kids to feed, and they'll probably
Yep.
keep doing it unless there's some alternative. And so what they're doing is they're just compensating them, helping them find another livelihood that is safe for the rest of us, and that helps to ensure that they're not doing it underground, right? That they have that cushion to fall back on. And so we hope to see China's getting a lot of blame for this, and there are certainly things they could have done differently at the beginning in terms of like being more transparent about what was going on and all of that. And but I think there are they don't want this to happen again either, right?
Of course.
And so
Yeah, no.
the wildlife trader compensation scheme is like a really creative, interesting solution. We're also seeing really cool solutions in Thailand. There's a group that started an initiative called PADD, which in Thai means, I think, eyes and ears, or something like that. And basically, they train farmers to look out for incidences of disease in livestock using an app. So they very carefully kind of track where animals are getting sick before that pathogen can spill over into humans. Because if you eat that animal, then there can be an outbreak, and then they're working to kind of report that back to government livestock officers. And so there are some little seeds of folks doing things on prevention. In our coalition, there's a great group called Health in Harmony that is working in Madagascar, Brazil, and Indonesia to provide medical care and job training to forest communities. So they'll stop logging, and that's resulted in, I think, like a 2/3 reduction in maternal mortality and also a 90% reduction in logging of primary forests.
Wow.
So a lot of the solutions are kind of at the grassroots level now, but we want to see kind of more policy action at a larger level. And so it's still, I mean, to your question, I think prevention, there's not any one country that's like, that we think is doing so great on it, but there's a lot of venues coming up like the G7 and the G20, COP26, that we hope we can kind of insert this into the narrative there.
Yeah, and it's just the very beginning of it all too. So I mean, something like this happens, which has not happened in any of our lifetimes. It's like shocking, and then it's like, okay, what do we do to figure out how to fix what's happening in front of our eyes right now? But just the conversation of how to fix it, and the fact that there's small initiatives going on seems like a great start. It has to start somewhere.
Yeah, definitely has to start somewhere.
But I'm sure it's going to take a lot of time to get it to where you want it to be.
It's a all hands on deck, I would imagine. Do you feel on that front? Sorry, just really, the actual question there. Do you feel that this is a government issue, or do you feel that this is a public? People need to be doing, like me as an individual in a society. What do I need to be doing something daily that would help, or do you feel this is more of a government? The governments need to be working together to fund the actual initiatives. What are your thoughts on that?
That's such a good question. I mean, I always try to think of what is there we can do. You know, sometimes it feels so hard as an individual to do anything, right? Especially when you're thinking of something like COVID-19. I think there are some actions we can take as individuals, but I think primarily this is going to take cooperation of the big governments. And what we're pushing for in our coalition is a global fund for pandemics that would include financing for things like all of those solutions I just mentioned. So having this be on a global scale. So we want to see that fund, but even at the individual level, we need to, I think the best way is like, how can we put pressure on our lawmakers to care about this? Again, I don't think that they have the incentive, just the way that our system works. It's like they're just focused on kind of pleasing people now to kind of, that's, maybe it sounds a little bit cynical, but I think that's sort of it.
I mean, has it changed in the last 100 years since our government became, it's never going to change because you have too many private interests. I have a great solution. If there's any politician out there listening and you want to pass a law, here's what you do. Ready? I'm going to hit you with this. Anybody that's in public office gets paid a salary, right? And they get paid a reasonable salary. They get paid absorbently, but let's assume that they get paid what they get paid. Let's say you're a House member and you get paid $170,000 a year and you get federal benefits forever. Fine, that's great. However, on your individual tax return, if you show $1 of other income, you are now kicked out of Congress or the House. You're dead. You would solve every single problem because it's all financial related. It's people donating to PACs. It's funding. It's book deals. It's all this crap that they're taking advantage of the system. And of course, they're going to perpetuate the issues. They make more money off it. It's the same way all the major news channels make more money when there's issues like this. It is what it is. That's how you do it.
Yeah. There could definitely be you should do a whole episode on public campaigns.
Yeah, like define the word public servant. I can tell you how you define it. You take no money except a reasonable salary to live because you can't pay them nothing and say, okay, go live. But but if you make $1 off anything related to your public office, dead, fired immediately. Go to purgatory.
So go to purgatory and stay there. It's so true. It's like I think we need to. It's so hard. I mean, we have like our daily lives. We're all so busy, but anything we can do to put pressure on our lawmakers, I don't think that many people have like called their congressional office. You should do it. and ask for what you want. You know, like they're there to serve us. And so for this issue in particular, like call your Congress member and say, like, what are you doing to make sure that we don't have another COVID-19 in 10 years? Are you supporting bills to shut down wildlife trade and to ban imports of goods that have illegal deforestation in the supply chain? They're not like they take their cues from the public, and so we have to have a louder voice about this.
Yeah, and you know, as you can see with today's age of social media, you know, you get enough people asking the same question or dealing with the same issue, people react. They feel forced to react.
Yeah, and that's what we want. We want them to feel like this is urgent and
Yeah,
you should care about it. Yeah.
that's a great suggestion. And we had Eric, if you remember, actually from the New Jersey Autobahn on, and we were talking, you know, on more of the local level and increasing, you know, public access to nature. And that was exactly his suggestion on the local level. Like, call your local open space committee, call your local politician, and start raising these questions and push them on what are you doing about this. And most people, I can tell you, I've never personally done it, and I may call up like, how are you preventing this from happening again? Because I don't want, you know, listen, we got lucky with COVID. All children are not impacted by COVID, not all children, but a lot of children are not impacted. We got very lucky. If COVID turned into children being directly affected and dying, and they probably are, right? So it's not to downplay it, but that being the case, this would be 9,000 times worse, because now you would have this crazy component to it. So yeah, let's get on that. Start calling and harassing the people that are able to pass laws and push legislation and push funding, because it's not happening enough.
Yeah, you know, it's so true. The point about children is so true. Like, we don't want to reach a point where we get a virus that affects kids, you know, in the way that, like, that would be terrible. And I think I suspect that if COVID affected kids, you know, at a larger scale, we would have been, you know, there's like taken better action on it. But we don't want to even test that. So
no. So as far as pandemics themselves, and I'm going to spitball a few questions at you, and if you have the data, say it. If you don't have it, that's fine. But you may, I imagine you're dealing with some of these. So with some of your bigger pandemics that have ever occurred, so I'll put COVID in there, I'll put Ebola in there, I'll put SARS in there, Zika is probably one of them in there. What is the typical, when you were saying before, like survival rate, transmission rate? Like COVID probably has a high transmission rate, but also a higher survival rate. Some of these historical pandemics and historical outbreaks of viruses, are there published statistics on that? And do you have any of that available potentially to like kind of like layer in, like when a pandemic gets worse, right? Like you were mentioning that a higher transmission rate with a lower survival rate, obviously, or with a higher death rate, if you will, another way to say it, obviously is much more impactful. We kind of got lucky a little bit because this pandemic had a very high transmission rate because it was respiratory. You know, you inhale it in and all of a sudden you have it, as opposed to having a lower, you know, death rate per se. You know, less people. You know, it targeted specific groups, people that had weaker immune systems, people that were elderly, you know, people that were really healthy weren't as negatively detrimented by it.
Right. Yeah, I mean, it's hard to say like an average across all of these because there's so many. There's like avian flu, swine flu, MERS, SARS, going back. And I think pandemics since the late 19th century have killed collectively around 40 million people. So a lot of people. But each one, there's no average, and I think that's what makes it scary. Like, because we know something's coming, but we don't know what, right? And so HIV is so different from COVID. They're both zoonotic diseases, and about 75% of emerging infectious diseases will be zoonotic. They'll be from animals. We do know that.
Oh, wow. So, 75%.
Yeah. So like, it's really the animal interaction, like the deforestation and the wildlife trade. It's the animal interaction that we have to stop. But it's hard to tell, you know, HIV, it's like sexually transmitted or blood transfusions, whereas with COVID, it's respiratory. We don't know until it appears. And then with something like Ebola, if you've seen someone with Ebola, it just ravages you, right? Like the deaths are very quick. And the next virus, we don't know. It could be something where it's incubated for like a month. You don't even know you have it for a month, and then it hits you.
Oh,
and so
geez.
that means like the spread. That's a very hard disease. Ebola, you can maybe contain it a little bit better because you know it's there right away, and so you can isolate that person. With something, if we get a new virus and it has an incubation period of a couple weeks, that person could fly all over the world before we even know they have it. That, so like all this, it's hard to say like there's an average transmissibility rate, or it's all kind of over the place. Like I said, Nipah virus, you get it and you're basically like, you are gonna die. Whereas with COVID, much less risk. So that's why it's scary. It's like there's no way to guess, and we don't want to have to do that.
Yeah, true. So based on that, I did a poll internally and asked people, are there any questions that you wanted me to ask you? So on that exact topic, one of the questions, which I don't know if this was a joke or not, but I don't think it was. On a scale of 1 to 10, should I build a bunker in case I never want to leave my house again out of straight fear?
Well, I definitely, that would be sad, right? If we were all in our own bunkers.
Stock up on those dried strawberries.
Yeah. No, don't do that. Just just push for like the things we've been talking about.
Push for funding.
Yes, yeah. Don't live in a bunker. That's not like the society I think we want to build. I understand the fear. And some of us, I feel like some people, I think some of my friends during this pandemic are like, oh, I realized I like hanging out. I don't really like so if you're that type, maybe you want a bunker because it's like more for you. But no, I don't think we should. Yeah, like I said, we don't want to, we kind of want to scare people so there's action, but we don't want our kids to grow up in a society where they can't go outside and,
they maintain our same way of living.
Exactly. Like we want to have parties, we want to go out, we want to go to the movies and do all of these things. And I think, yes, after you're vaccinated, do those things, do whatever the CDC and your local guidelines say is safe. But I would say don't forget how you have felt this past year. It's history shows. I mean, there was a 1918 flu pandemic right after after World War I.
Mm-hmm.
A lot of people died from that, and right after that we had the Roaring '20s, and I feel like that is not by that's not by. Part of that is we were like, I want to forget that happened. It was a really tough time. Like, let's just have fun. And I want to have, like, I think there might be another Roaring '20s this time around where like people go a little nuts. But I don't want to forget this time, like how painful this was. So I'd say don't build a bunker, but don't forget what we all went through collectively. It's going to be really tempting to, really, really tempting to just be like, okay, that's in the past. We can't afford to do that.
That's a great point, and that's something very important to think about, because you're right. I think everyone's inclination is, well, I haven't traveled in a year. Let me go get all my traveling out of my system. I haven't been able to go party or go outside or go in large gatherings or even go to church for that matter. Now I'm just going to go head into it. And oh yeah, by the way, I feel like the world owes me something because I just had my freedoms taken away for a year and a half, and so I'm going to take advantage of that. And you see it in some places are already. You see in the news, some places are probably already taking advantage of that, certain locations in the United States specifically, which I won't mention. But, the reality is that you're right. It's called human nature. People feel that, they're owed something, or people feel that, well, this actually taught me I don't have a lot of time on this earth. It actually taught me that mortality is something that's very, very fragile, and that I need to then, change my lifestyle or maybe increase my lifestyle in a certain way and not care so much about work. And so I think you're 100% right. That's a great analogy, because the 20s with the war, the war that happened, and with crazy, pandemic that occurred, and with a lot of other, cars being invented. There were a lot of, and all of that, if you take that, a lot of that's happening now. Invention of technology. We have some wars that are somewhat ending, as well as somewhat beginning right now. You have this crazy political and ideological divide in our country that's just, you can't even quantify how mad some people are at each other because you post something wrong on Facebook, which blows my mind. And we've been cooped up in our house with the pandemic. Some people have been negatively, disproportionately affected by it. Now they're maybe less affected, or some people weren't affected at all financially, but they couldn't do anything. So now we're going to take all those resources we would have deployed, that now we're going to deploy them now. So yeah, that's a super valid point. So don't forget, everybody out there listening, keep this in mind and remember that we still have a lot of work to do. And, doesn't mean you can't go have fun, but we have a lot of work to do. Yeah, interesting.
A lot of work to do. Yeah,
a lot of work to do. So, publicly, is there anything the public can do to support, work that, Dahlberg Catalyst is doing that may help you continue to do the work you're doing?
Definitely. I mean, I'd say first, again, we work a lot at this intersection of environment and health, and this is our main priority right now. So if you're interested in this topic, you can look at our website for this initiative at preventingfuturepandemics.org. And there's a lot of great resources on there, a lot of our press that really, in a crisp way, kind of explains this issue. So I'd say just, educate yourself. I think if you do that, you'll know more than even some of the top leaders. So do that. Again, like I said, kind of put pressure on your local lawmakers and, to do the right thing and to not forget. That's what we need to do collectively, to not forget. And I just say, like, it's so crazy to think about. If you really take a step back and think about this, it's like, a year plus ago, 7,000 miles away, there was a bat or a pangolin. And there's like, it had a pathogen and it spilled over into like one person or a few people. And now, my neighbor has died, my business has closed. Like it's so crazy to think about just like these animals, right, on the other side of the world. And just there's this single event can have a ripple that affects the latest stats, over 3 million dead, I think 150 million infections. It can be a very small thing. And so we have that work to do, and we'll never be able to stop every outbreak, but we can certainly, stop a lot of them. Like, we have power here. That's the big message. Like, there's a lot of folks that think this was inevitable or out of our control. We have some level of control, and so we should exercise that. And so just keep that in mind, and put that pressure on the folks in charge, and read about this on your own, and stay safe, and don't forget.
Don't forget.
Yeah.
And definitely read there's a couple articles out there that you, Dahlberg, and the coalition have published, which I think are great out there. One on Politico about preventing the next pandemic, or how to stop a pandemic before it starts. I think I love the illustration in it. There's a lot of very fun graphics. That was just, it's easy to follow, and it gives you a lot of just information that, before you and I chatted, and Ashley and I chatted about this, I'll be honest, I was completely ignorant to it. I was, wasn't thinking in this direction at all. We're all thinking exactly what you said. How do I get out of this, and how do I get back to my normal life? And the reality is, let's pump the brakes on that a minute and say, okay, let's learn from it. Let's figure out how to go forward, and let's figure out how we can fund the right initiatives to prevent a worse, larger scale event from occurring, which somewhat is inevitable based on what you're saying and what much of the science says, just based on us not changing our practices.
Exactly. Yeah, we keep going down this path. Yeah. So, the Politico article was great. The John Oliver episode, I would highly recommend on the next pandemic as well, if you're a fan of his. So there's more and more info coming out about this, so be sure to follow it. And it's great to see. Thank you for giving us this platform to also talk about this as well, because it's so important, and we want to get as many people thinking about this as possible.
Definitely. This is a huge thing. And I think it just shines a lot of light on too that we're all connected, and that connectivity could lead to some tragedy. But also on the other side of it, if we're all connected and trying to make something better, it could serve us well as well.
Absolutely. Yeah, that's a great way to put it.
Awesome. Well, thanks so much for your time. Any I know you just kind of laid out your closing thoughts in that, but anything else you want to share or talk through before we bid you adieu?
No, I think that's it. This has been great. Thank you so much. And yeah, that's all I would say. And again, don't forget, yeah, just get educated on this.
Perfect.
And thank you all again.
Hey Warriors, thanks for tuning in. Make sure to subscribe to Civic Warriors, and thanks for all your support. Have a great day.